Hi, I'm Steve Knighton from Nottinghill Family Wellness Center, and today we're going to talk about IT Syndrome. We see this in a lot of cyclists and runners and just people sit at the chair all day. Being an avid cyclist myself, we get a lot of my friends and a lot of people our advice with coming into clinic with IT Syndrome. Essentially, the IT band is in the side of your leg. It attaches it forms from your glute in your hip area, comes down the leg and attaches to the south side of your knee here. It's basically used so that when you're walking, your knee won't jet out and it kind of holds the leg into one place. What happens though is the tissue gets extremely tight. It's not really a muscle, it's more of a fascia, and it can get stuck to the hamstring down in here. It can get stuck to the vastus lateralis, especially in cyclists, massively overused big muscle they get up in here if you see some jack cyclists riding. And then it can cause massive pain. It can cause pain down at the knee, past the knee, shooting down. It can even cause some hip pain in there, just with the structure. With a lot of people sitting at desks these days, we get this anterior pelvic tilt going on right now, where basically your pelvis is all angled wrong, so everything biomechanically is working wrong, and that starts everything getting tight in the IT band. So the IT band forms at the glute, works around your hip, comes down the outside of your leg, attaches to the south side of your knee. We see it a lot in runners and cyclists, and to be honest with you, just with COVID, a lot of people just sitting at the desk all day.
Okay, so let's recap. The IT band is a piece of fascia that runs from the top of the hip to just below the knee. Fascia is connective tissue that has a few different roles, including enclosing muscles, helping to connect muscle to bone, and compartmentalizing muscles that have similar functions. The main function of the IT band is to stabilize the outside of the hip and knee, but it also passively contributes to some movements depending on the position of the leg. The IT band is connected at the hip and at the knee, but it's not tethered down anywhere in between, so repetitive knee flexion and extension causes some friction over a bony part of the knee, and this causes irritation. For this reason, runners and cyclists are often athletes who end up experiencing this kind of pain. Pain from IT band syndrome is felt on the outside of the knee. It can result in a tight feeling up the side of the leg and into the glutes. Swelling may be present on the outside of the knee, and pain typically gets worse with activity.